Thanks, Christy. So this topic is actually a little bit interesting, and it's why Foregut needs a fellowship, the Fellowship Council perspective. And it's actually probably not really the Fellowship Council perspective because that's not really where it started. But I'll get to that as we describe a little bit of the story. So these are my disclosures. I think the only thing that's really relevant is that I'm the immediate past president of the Fellowship Council and the past president of SAGES. So I've been involved on both sides of this as we rolled out this Foregut Fellowship, and I can explain a little bit of the history and kind of the background. So from the Fellowship Council, this has been in existence for a number of years. We now have 185 programs that are supervised by the Fellowship Council with 238 fellow positions. And on the slide here are the different types of fellowships that are covered by the Fellowship Council. What the Fellowship Council does is it accredits the fellowships. We regularly site visit or virtually site visit and make sure that they're meeting the requirements that are actually set out by the surgical societies. So it's sort of a partnership. It's not all done by the society. It's not all done by the Fellowship Council. The council credits the individual programs based on those guidelines, and then the certificates actually come from the societies for the graduating fellows. So it's a little bit of a dichotomy there in how that works. But looking at these different fellowship types and thinking about Foregut, these are the fellowship types that actually do a fair amount of Foregut in their practice. So Advanced GI MIS, Bariatrics, the Comprehensive Flexendo, and Thoracic fellowships all touch in the space of Foregut. Looking through at the Advanced GI MIS, which was recently redone by SAGES with more specificity. It used to just be 150 complex MIS cases of any type to be an MIS fellowship. About 4 years ago now, we came up with new criteria that had a little more discrete breakdown, which is shown here on the screen. In that, you can see that there were 20 Foregut cases, which is not a whole lot, but some, and then inguinal hernia and ventral hernia as well. These are the societies that cover those different societies, that those different fellowship types that have the breakdown. So SSAT is technically responsible for Advanced GI, SAGES, Advanced GI MIS, Bariatrics, ASMBS. So you can see there's a lot of different partners that interact in this space. Comprehensive Flexendo, which has recently been rebranded, is done by SAGES, and thanks to Dr. Paulai for the help with that. Thoracic is interesting. It's not even really society sponsored. It's just the program directors that have those thoracic fellowships that get together and help us build the curriculum and the requirements for those fellowship types. So obviously it's a very, very close interaction between the Fellowship Council and the sponsoring societies. The Fellowship Council members are all the program directors. The board comes up through that program director society, but then we have reps from the different sponsoring societies on that board, and then the Fellowship Council committees are actually populated by the sponsoring societies who nominate people to sit on that. So it's a very interactive group, but again, the fellowship criteria come from the sponsoring society and then are approved and regulated by the Fellowship Council. So as we decided, and this actually came out of SAGES, is where the collaborative Foregut concept came, and we realized that since there's a specialty in this area, a lot of people are really diving deep into Foregut, we probably needed a little more discrete definition of it than just came from the MIS fellowship type. But we also realized that there are all these other stakeholders in that space, and instead of doing it as a competition among us, we thought it would be better to do this together. So this is a new paradigm for the Fellowship Council. So we actually set up this collaborative Foregut group. 3 leaders in the initial group, 1 from SAGES, 1 from SSAT, 1 from ASMBS, and for the certificate, they actually work collaboratively, and any changes in this fellowship type will come through that. More recently, the American Foregut Society is a new Fellowship Council sponsoring society, and they have joined to partner in this collaborative group. So they are working with the same fellowship. And I think this keeps us from being in competition with each other, and again, more synergistic as things move forward. So that's the background to how we set it up. Then you can pretend I'm Dr. Awad, and this is the second half of the talk. So he unfortunately had a family emergency and can't be here, but these are his slides and my take on his slides with a little bit of a twist. So Foregut as a specialty, these are some of the things that we consider as central to Foregut. So reflux, hiatal hernia, achalasia, I think all of us can agree those are central to Foregut. But there's been some increasing complexity and some new ideas on how to manage these things. It gets a little deeper as you look at some of the evaluation of the foregut diseases, and then some of the new modalities for treatment, including robotic, endoscopic, and new devices. So there is a lot more depth and breadth to this specialty than what existed even just 10 years ago. So again, that collaborative Foregut group got together and tried to define what these fellowships should be, and looking at what the curriculum and the content for these fellowships should be. And that started really in April of 2019. So how we move forward is getting data from the existing fellows across all the different fellowship types, looking at a breakdown of cases that we thought were relevant for Foregut, taking in how many fundoplications, how many paraesophageal hernias, how many Heller myotomies, for instance, were done by that group, and trying to figure out what the minimum threshold of a program should be to consider it to be deep enough in the Foregut space. It got a little bit muddy as we figured bariatrics, because a lot of the bariatrics cases really are Foregut cases, and that skill set really does overlap a lot, but we also felt that it shouldn't be just bariatric, that would be an inappropriate definition of a Foregut fellowship. So as you see on the slide here, these are the case breakdown that we came up with, which was 75 minimally invasive foregut procedures, including some flex endo, some revisional cases, as well as some additional advanced procedures, and then the bariatric cases were capped. We did feel that it was important that flex endo is critical and central to management of foregut disease, so we wanted that number to be significant. And then some of the physiology studies should be interpreted by those fellows. The certification process, as I talked about, has that collaborative group working together with the societies helping to actually make the certificates. Historically, it's really been one society for one fellowship certificate type, and this group is the first time we've done it collaboratively. The first class that finished with this designation was in 2021, and we actually had 15 people receive the certificate from Foregut. We've also worked with an initiative that started last year to help define the curriculum a little more, and this is not just the case types, but the diseases and the topics that we're teaching the fellows on. So on the screen here, these are the topics that we wanted to make sure that the fellows are learning about, and we're actively populating these things on the Fellowship Council website so that program directors can actually link to materials and even some talks that are pre-populated to make education in these things easier for helping with our fellows. Beyond the fellowship, there is a lot of training in this space, and I think SAGES has really chosen to dive deep into Foregut. This is the master's pathway. You may have heard in Dr. Feldman's presidential address that the OWLS organizational-wide learning system has gone live, actually goes live on Monday, and with that we can access some pretty deep educational topics. Foregut is the first one that is readily available. It's going to be pretty spectacular, so please check it out. But this is something that I think could potentially partner well with the Fellowship Council as a way to access some learning materials. With that, there's a lot of other things, including anchoring procedures, video assessment, that I think this Foregut fellowship may be some of the first to experience through our societies. So again, the master's program has 3 different levels: competency, proficiency, and mastery. And as it gets more higher levels, it's more complex procedures. So for Foregut, competency is fundoplication and basic hiatal hernia. Proficiency gets to paraesophageal hernia and Heller myotomy. And then the mastery level is going to be reoperative foregut surgery. So please check that out. I think it's going to be fabulous. So hopefully that's a little overview of where we got to the idea of the foregut fellowships and how we set them up initially. I'm happy to talk more as we get to the question and answers. Thanks.